Hi, everyone. Welcome back. Today, we're joined by Morissa Henn, Intermountain's Community Health Director, and Clark Aposhian, a chairman for the Utah Shooting Sports Council. Sorry about that. And today, we're going to be speaking about firearm safety, specifically around COVID-19, and having a discussion about the best practices during this time. So, Morissa and Clark, thank you so much for joining us. We really appreciate it.
Thank you.
Thank you.
And first of all, what led the two of you guys to work together? A gun lobbyist and a health professional seem like a little bit of an unusual team. Will you kind of explain your background on that?
Yeah, so it is a bit unusual, but very intentionally so. So when I was fortunate enough to come to Utah and start working on the issue of suicide, it became very quickly apparent that suicide and access to firearms are very linked. But the truth is that our gun community, really led by Clark, have been such leaders in recognizing that we all share a common goal, which is keeping our families and ourselves safe. And so we sort of started from that common denominator of saying, all of us want safety for ourselves and our families. How can we begin to collaborate? Because the truth is, a health professional like myself has access to data and best practices, but we need people like Clark and his colleagues to really help us come up with the community-oriented solutions that can make a difference.
Yeah. And I mean, and with regards to suicide prevention, we're not talking about an anti-gun or even a pro-gun approach.
Mm-hmm.
It is a collaboration that's, it's really built on trust over the last 7 years. And, we leave the rhetoric at the door and we work on a common problem, because something that we can all agree on is that no one in a crisis should have access to a gun. And that's not pro-gun, it's not anti-gun, it's just common sense.
Mm-hmm. So have you guys been working together for the past 7 years then? Is that correct?
Well, I haven't. Yeah. Go ahead, Clark.
Yeah, I first started working with, I believe it was your mentor, Kathy Barber at Harvard University, and then Morissa came on just after that.
Okay.
Yeah, and the work of the Harvard Injury Control Research Center, and especially Kathy, has been so instrumental here in Utah and nationally in helping provide the data and then helping bring people together around this common cause issue. And in fact, the Harvard Injury Control Research Center received funding through an RFP that the state legislature made available to research this issue. And in coalition with Clark and our other colleagues across the state, we've been able to use that data, again, kind of generated with no political agenda in mind, just a goal of preventing these tragic suicides. So that work that Kathy helped spark, and our colleague Kim Myers at the Department of Human Services has carried forward, has been really important. And I will say, here at Intermountain, Clark's input and that of other gun owners has been crucial as we help train health professionals in how to talk about firearms in a way that is comfortable and effective and respectful, as well as many other important media and education campaigns that are ongoing. So, Clark, I don't know if you want to mention the concealed carry module as well.
Well, exactly, and this is what we do: is we work within our existing parameters. The concealed carry firearm program here in Utah has a huge number of gun owners in it, that do that. So what we did is we moved in a module to the required training that talks about suicide, and it's a very open. It's heavy on the data, which a lot of gun owners want to see. They don't want to see a lot of the emotion; they'd rather data. And in addition to that, the legislation that has been proposed and has been passed doesn't have any mandates to it, because we don't really like mandates for gun owners, and it just wouldn't go very well. But things like we build on friends don't let friends drive drunk type of thing. That doesn't involve the government. That doesn't involve the police coming and taking your car keys or something like that. It's friends, it's family, it's loved ones, it's coworkers, it's neighbors that are stepping in to help you out for that crisis period.
Yeah, and there's been a numerous number of national media stories about the increase of gun sales, especially during this COVID-19 pandemic. Why do you guys think that people are purchasing more guns right now?
You want me to take that one, Morissa?
Go for it.
Well, in my opinion, because I think everybody has a different reason for sharing. Many of these are probably people that have wanted to buy a gun for a long time and just saw this urgency at this point and said, hey, if I don't get one now, maybe they won't be around. Or, it's like buying toilet paper, so to speak. You got to get what you get when you can. And in another way, perhaps they are expanding on hey, the government can't help us in everything. And the government's not going to be there to, it's being stretched too thin. So maybe I do need a firearm for self-defense and that type of thing. And for the new gun owners that didn't grow up with guns, that don't have a gun owner in the family and that type of thing, we really encourage them to get some training. And there's lots and lots of training counselors out there that can help them, because we'd rather, if you didn't grow up around guns, we'd hope you're not going to use it in an emotional way.
Yeah, it seems like
we don't necessarily see that happening either. So, Morissa?
It seems like Clark and I have been in close touch the last few weeks because of this increased sense of instability, this sense of unpredictability. And Clark has been a really important source as I've thought, how do we understand the moment we're in? And that for some people, that is leading to perhaps a desire to go purchase more guns or ammunition. And what do we do in response to that as we build on our suicide prevention work?
Yeah, my next question for you guys was going to be about suicide prevention specifically. Why could this increase in gun sales be concerning from a suicide prevention standpoint? This kind of goes into line with the question we just got, which I'll ask afterwards, but I'll let Morissa, do you want to go first on that one?
Sure. Yeah, I mean, we know that this is really a time of unprecedented uncertainty in a way. There's a lot of issues around COVID that can sometimes exacerbate the stresses we already feel. You have social isolation on top of that, and just a general feeling of kind of stress, whether it's due to the socioeconomic issues going on or the sense of physical concern for our health. And so we know that for some people, suicide risk may be heightened. We know this based on past crisis and disaster events. And so one of the things that we think about in this kind of common ground structure is, what are the things people can be doing to have control over their lives, that they can be doing to make their homes more safe, and reminding them that there are things other than buying more guns and ammo that we can do, whether that's focusing on physical distancing, whether it's thinking about keeping our homes clean, whether it's thinking about getting to know your neighbors and being aware of their needs. Much as Clark and my collaboration is really about people from very different backgrounds learning how to connect and do so in a way that's really based on respect.
Indeed, and I think you'd agree with me, Morissa, or maybe you won't, that new-time gun buyers, that we haven't necessarily seen an uptick in suicides for first-time gun buyers. Is that right?
Yeah, we don't necessarily know. There's some interesting research going on right now to understand kind of the relationship between gun purchasing and suicide, but for sure, it seems like whether someone's looking to buy a gun for the first time or they already have them, which we know the majority of Utah homes do, how do we ensure that safety, particularly at these emotionally more vulnerable times we're in?
And that was my next question for you, actually. So like you mentioned, more than half of Utahns actually own guns right now. What can they be doing to ensure gun prevention, specifically gun prevention for suicide, especially right now?
When you say gun prevention, you mean suicide?
Gun safety and suicide prevention.
Yes. In every class I teach, whether it be a bail agent class or a concealed carry class or an armored truck class or whatever, we talk about storage of your firearm, because each family is going to be a little bit different. Maybe you live alone, maybe you live with a spouse, maybe you live with a whole family full of gun people. Is that they've got to be stored in such a way that you can deny access to everyone who shouldn't have access to them. Mm-hmm. And from time to time, when you have, somebody in crisis in your home, you've got to step that up and be able to effectively deny access. Just because you have a cable lock on your gun doesn't mean that it is unbreakable. You've got to apply the proper storage. And that can include, in some situations, actually storing the firearm offsite at a trusted friend's house, somebody that's obviously allowed to have them as well. And we've passed legislation here in Utah for safe harbor. Law enforcement agencies have to take those without questions not asked, and they aren't recording serial numbers or anything like that. We restrict about that. But there are definitely options to use if you don't have a gun safe or a vault or something like that.
Yeah, and I think building on what Clark said about some of the options around offsite storage, we know that that's not always feasible or possible for all people. And so in those cases, we recommend really thinking about at-home storage, secure storage in a safe or lockbox with the key or combination kept away from the person that you're concerned about. And that person may be you. It may be that you need a friend or a loved one to change that combination and make sure that you don't have access to it. Something neat that's going on right now is that the state of Utah is actually offering a rebate of up to $100 toward a safe or lockbox. This is for concealed carry permit holders who live here in Utah. And we'll post a link with information. They still have lots of these rebates left. So it's a great time right now to be looking to purchase that new safe or an additional lockbox for your self-defense gun. As Clark said, the trigger and cable locks that you often see, they're usually just a few dollars, maybe $10 at most. They're better than nothing, but they're not really adequate on their own. It's a good idea to use a cable lock maybe in combination with the safe. That said, it's a really important thing if you're waiting to buy a safe or just to use in combination. So Intermountain Healthcare has a big goal of making lots of these cable locks available in healthcare facilities. And we actually could really use the help of viewers. If you work at a clinic, at a hospital, not necessarily Intermountain, in fact, almost more important if you're not an Intermountain facility, we would really love your help. We will provide the gun locks and literature to you. The literature has been vetted by Clark and his colleagues. It has their Utah Shooting Sports Council logo on it. And we would love your help distributing these. And we will include the link afterward, but especially pharmacies. That's a big focus right now if you're a non-Intermountain pharmacy in Utah or Idaho.
And one thing I'll add is that we live in an era now where there's a lot of products out there that can still securely, secure your firearm against unauthorized access, but still give that owner, if they're not the one in crisis, immediate access to it, because that's a big thing in Utah and across this nation, that gun owners still want to have access to a firearm, but they want to deny that to somebody who's in crisis.
Yeah. So we just got a question, and I'm not sure if you guys can answer this or not, but someone asked, have you guys considered working with the University of Utah and the DoD that are doing research right now on the crisis response planning and reducing suicidal ideation? I don't know if either of you can speak to that, but if you can.
We can, Morissa, and in fact, we've been working with the Veterans Department there and I can't remember the name of the Veterans Department there but we do work closely with them.
Yeah, we do a lot of work with Dr. Craig Bryan at the National Center for Veteran Studies based at the University of Utah, as well as with colleagues at the University of Utah's crisis team. They have an amazing group of people who share our passion for coming together on this issue. So we'll continue to build on that, especially as we focus on veterans and other high-risk groups. So great question.
Yeah, I think it's important to note too that, like you said, this isn't just like an Intermountain issue. This is a state issue, a state thing that we all need to kind of work together to make sure we can get to a better place. It doesn't just lie within one healthcare system to take on this responsibility. So what are some other suicide prevention projects that you guys have been working on together as well?
Yeah, well, one of them that has been especially exciting is this brand new social norms campaign that was announced in September. Intermountain Healthcare, the Church of Jesus Christ of Latter-day Saints, and a number of University of Utah and others, including the Utah Shooting Sports Council, actually, raised $1 million that the legislature matched. So we had $2 million, and it's going to be going toward a major population-oriented media and education campaign, of which safe firearm storage is a major component. So Clark has been part of our steering committee. He's also had other board members who have been actively participating to really get the message out that we're talking about at a much more large scale, kind of dynamic, population-oriented way.
Another one is we both participated in a major international documentary called Wake Up, which should actually be in theaters here, limited release here in theaters, I'm told. We have co-authored op-eds in the newspapers, and I've had you on my radio show too, on Gun Radio Utah.
Yeah, Clark has really created a lot of opportunities. And I think the message that we hope we are conveying to people is that Clark and I disagree on a lot of different things, a really long list of things. But on this issue, there is so much common ground to be had. And we need one another. We need our other colleagues and friends from the public health community, from the gun community, to be part of a joint effort that really builds on that common ground. Just as Clark said, this is no different from friends helping friends. These are times in our lives where we need to be thinking about that commonality and that way of coming together, recognizing that that's kind of the spirit of what public health is all about, is taking very diverse approaches, multifaceted approaches to complex problems.
Yeah, I think the concept of being there for your community, and if you know someone who wants to potentially place their firearm somewhere else, knowing also how to reach out to them and talk to them about that. Can you talk a little bit about, just as our last thing, the Zero Suicide link that I can put up and exactly what people can find out there?
Yeah, so feel free to check it out. It's Intermountain Healthcare /Zero Suicide. And one of the first things you'll notice in the upper right-hand corner is an order form if you'd like to have gun locks delivered to your organization. We're especially focused on healthcare facilities, so pharmacies, clinics, hospitals, mostly because there's already been a lot of focus on community organizations. And on that website, you'll also find a lot of great resources around suicide prevention, warning signs, the state hotline, which we always like to share, which is 1-800-273-TALK. You can get to the hotline, as well as our emotional health relief hotline, which was just set up around COVID, which is 833-442-2211. But lots of great resources linked to there that will highlight more of some of the collaborative efforts that we've been involved with the gun community and with many others.
I just want to add that Intermountain Healthcare has been fantastic in this, and to remind folks about that hotline, because even if you suspect someone may be in crisis, you can call that. You don't have to give them their name, but you can get ideas on how to help them, or the strategies to give to them to help them. And it's so important. Be on the lookout, for your friends and your family and neighbors and that at this time. And if they're in crisis, help them.
Yeah, that's really important. Thank you both so much for joining us today. We really appreciate you guys taking the time to talk about this topic. And if you guys are experiencing mild to moderate symptoms of COVID-19 and would like to speak to someone, you can do so by calling our COVID-19 hotline at 844-442-5224. The other resource we have that Morissa talked about is the Emotional Health Relief Hotline, and that phone number is 833-442-2211. It's available 7 days a week from 10 a.m. to 10 p.m. And like they both mentioned, you can call to talk about your own emotional distress that you're going through, or if you have someone that you need help with as well. So thank you both so much for joining us, and we'll talk to you guys next time.
Thank you.
Thank you.